On September 22, 2025, Cancer Biology and Medicine published a special issue on eliminating cervical cancer, a global health imperative for women. Cervical cancer is a major challenge to women's health worldwide, causing over 300,000 deaths annually. As the only cancer with a known and preventable cause, advancements in science and technology offer new hope for its control. In 2020, the WHO launched the Global Strategy to accelerate the elimination of cervical cancer, aiming for 90-70-90 goals by 2030. This initiative offers clear direction and a practical framework for global prevention and control efforts. To achieve this goal, countries are taking active measures. Many have added the HPV vaccine to national immunization programs to prevent cervical cancer at its source. At the same time, they are developing innovative screening and early diagnostic methods to improve early detection and treatment. Through these combined efforts, numerous countries are steadily advancing cervical cancer prevention and ensuring more women receive timely and effective protection. However, in many regions with limited healthcare resources, the prevention and control of cervical cancer still face significant challenges. Scarce healthcare resources, weak infrastructure, inconvenient transportation, and a shortage of medical personnel make it difficult for women in these areas to access effective and timely cervical cancer screening and treatment. Nevertheless, countless healthcare workers, undeterred by hardships, traverse the rugged mountain roads of the Ileo Mountains in Yunnan to deliver screening services to remote villages. They venture deep into the vast pastures of Ordos, Inner Mongolia, providing free HPV vaccinations to local middle school girls and offering free cervical cancer screening and treatment to adult women. They climb mountains and cross valleys to reach the Tibetan mothers herding yaks in Songpan, Sichuan, bringing professional screening techniques and medical support, allowing these women to feel the care and warmth of society. In 1995, Beijing hosted the UN Fourth World Conference on Women, a landmark event for gender equality worldwide. 30 years later, China hosted a global gathering, the Global Leaders Meeting on Women, to advance the cause of women's development. Professor Yulin Qiao, a leading figure in China's cervical cancer prevention and treatment efforts, has led large-scale vaccination and screening programs across the country while promoting global academic exchanges and cooperation. His dedication aims to create a more equitable and accessible cervical cancer prevention system worldwide. Cancer Biology and Medicine is an open-access journal sponsored by the China Anti-Cancer Association and Tianjin Medical University Cancer Institute and Hospital, National Clinical Research Center for Cancer. It was founded and led by Editor-in-Chief Professor Xishan Hao, a renowned Chinese oncologist and academician of the Chinese Academy of Engineering. To mark the 30th anniversary of the United Nations Fourth World Conference on Women and the Global Leaders Meeting on Women in Beijing, Cancer Biology and Medicine has invited its Associate Editor-in-Chief, Professor Yulin Qiao, as the guest editor, to release a special issue on cervical cancer elimination. The special issue opens with an editorial from WHO experts discussing global disparities in cervical cancer prevention and China's contributions to its elimination. One study explores how modeling can guide policy in low- and middle-income countries, while another analyzes cervical cancer trends in China from 2000 to 2020, urging expanded HPV screening and vaccination to speed up prevention efforts. The special issue also highlights two innovative cervical cancer-related technologies developed by Professor Yulin Qiao's team with Tencent SSV Inclusive Health Laboratory. One is iDeco, an intelligent colposcopy training platform that has conducted 18 sessions across more than 30 countries, training over 1,000 participants. A study shows it significantly improves colposcopists' accuracy in diagnosing high-grade cervical lesions, demonstrating the potential of digital education in enhancing global screening quality. The issue also features a smart digital platform for cervical cancer screening, which reduces overscreening and improves high-grade lesion detection, offering new approaches and technical pathways for screening management. This special issue showcases the latest research in cervical cancer prevention and treatment, offering solutions to eliminate the disease globally. Cervical cancer could become the first cancer fully preventable through vaccination, screening, and early treatment. Scan the QR code to subscribe and support global efforts to eliminate cervical cancer.